Okay, started your timer, and here is your question. Right, so if you have read and understood, considering it communication skills station, kindly begin.
Right.
Begin, please.
I'm ready, ma'am.
Yes, Dr. George, are you there? Oh,
Oh, sorry. I'm here.
yes, please begin.
Good afternoon. My name is Dr. George, and I'm an orthopedic trainee here. I'll be representing my consultants. May I confirm your name and age, please?
I'm Mr. Stephen John. I'm 32 years old.
Okay, Mr. Stephen.
Yeah, are you the one I'm waiting for? Is it my turn? Is it my turn now for the operation? Please.
Good. Yes.
Yes, Mr. Stephen. I understand you're supposed to have your operation today for your knee, for an arthroscopy.
Yes. Exactly.
But I'm sorry, Mr. Stephen, we would have to stand down your operation for today. My consultant has just been called for an emergency. So he is in the operating theater now and attending to an emergency that just came in.
What do you mean by that,
sorry
doctor?
about that.
What do you mean by that, doctor?
Good.
Do you mean my operation is not an emergency? What do you mean, doctor?
Mr. Stephen, I'm very sorry about that. I know from your notes, your operation has been postponed 2 times. And it was really a wish to have done this today because I know your leg.
Yes.
I understand, Mr. Stephen. It's also of concern to us. We wish we would have really done this today, but another emergency came in. We try to prioritize emergencies to at least those that are those that we need to save the life theater. It does not mean you're not important to us or your case is not important to us. I'm really sorry about that, Mr. Stephen.
Okay. Would you call the doctor now? Can I speak with him? Would you call him now? Now, right away, please. Like, I need to speak with him.
I'm really sorry. Like I told you, he's already operating in the theater. I won't be able to reach him now. I'm sorry about that.
Then I need another consultant to do it right away because I can't stand
I'm sorry about that.
Postpone the day. Can I at least have that request attended to? I need another consultant.
Hello.
Doctor. Yeah,
Yes,
with
explain.
you. I need another consultant.
Explain the circumstances. Yes.
Okay. Yes, Mr. Stephen, I know it's your right for you to request for another consultant, but the circumstances around this is if we should refer you to another consultant, he will need to go through your notes all over and go through your case all over. This may be time consuming for you, and it may even take more time than we would have to do for you. So I would plead that you stay with us.
Yeah, I get you, but at least you know my case. I've been coming here. I see you from time to time with the
Hello,
consultant.
Mr. Stephen. I can't hear you.
Can you hear me now? Hello? Hello?
We can hear, Dr. George.
Hello, doctor. Hello, doctor.
Yes, yes, I can hear you now.
Okay, doctor, I come here every time and I meet you. At least you know my case. Can you do it for me?
Yes, I do.
Well,
Well,
can you do the operation yourself, please?
I'm sorry, Mr. Stephen. I'm not really allowed to carry out such procedures without the supervision of my consultant. And since he's not available at the moment, I may not be able to do that for you. I'm sorry.
So give me another appointment now. Let me know when it can be, if it will be comfortable for me.
Hello?
Hello?
There's something wrong with your network, Dr. George. We can
Mr.
hear.
Stephen, can you hear me?
Yes.
Yes, I can hear you.
Go ahead, please.
So
Yes,
please give me another appointment. Yeah, give me another appointment right away to see if it will be
Okay,
convenient.
I may not be able to, I'm sorry, I may not be able to give you another appointment right away, but I would make sure to discuss your circumstances and events and how necessary it is for you to have these procedure done early enough. We would ensure to communicate the next available dates to you as soon as possible, but I may not be able to give you an appointment right away.
I'm really not happy because you see, my son right here with me came all the way from Australia 2 days ago just to be with me in this operation for this surgery. And now you are going to postpone the operation. You can't even give me a definite time.
Hello?
Okay. Hello. Hello.
Hello?
Hello, ma'am. Can you hear me?
Yes, yes, we can. It's something wrong with his network.
Hello? Yes, I'm sorry. I head up to the point where you said your son came from Australia.
Yes, for this operation, and now you can't really tell me a definite time to see if he could be around to, you know, for whatever time you give to me to know if he will still be available for the operation, you know. But be that as it may, you can promise me whenever you fix it, you are not going to postpone it again, doctor. Hello.
We'll do our best to ensure that. Yes, I can hear you. I can hear you, Mr. Stephen. We'll do our best to ensure that when next we book you, we would carry out the procedure. But all the same, like I told you, we prioritize emergencies. In the event where we may have an emergency, such as today, I'm sorry, Mr. Stephen, we may have to prioritize the emergency. But we will do our best to ensure that we do your case as soon as possible.
Okay, so what am I going to do about my workplace? I took permission for this operation. What am I going to do about it?
Okay, understanding the circumstances about that, I could put in a medical note, a medical report for you stating the medical reasons why you wouldn't be at work, and possibly to extend your sick leave. Since we have postponed your procedure, you may have to stay a little bit longer before your procedure. And if you don't mind, I could still speak with your employer, explaining these things to him.
Okay, that would be nice, really. But doctor, I want to know if I can walk on this leg. Really, I want to know this, my right knee. It's really painful. What do you advise, please? Yeah.
Well, bearing weight at the moment and working may cause some more form of injury. I would advise you rest the limb, but you do not bear weight or work with it. But you can also do some other exercises which will not really entail you having to stretch the legs so much. Like you could do some swimmings. Moreover, I could refer you to a physiotherapist who would recommend who would recommend some exercises for you, which would help strengthen the muscles around your knee. But for now, I wouldn't really advise that you walk around or run with it.
Okay, that's good to know. That's good to know. But doctor, one more
So,
thing.
Mr. Stephen, bearing in mind all that we've discussed, if you don't mind, I would like to summarize or go through what we've talked about already. You were supposed to have your arthroscopy operation done for you on your right knee today, but we are really sorry. My consultant has been called to do an emergency operation, which we won't be able to do your procedure today. But we will try to schedule you for the next available date, which we will communicate to you. Sorry for every inconvenience, Mr. Stephen.
All right, doctor. Yeah, very good. Thank you very much. Now I'm a little bit relaxed. Okay, but one more thing before you go. There's this medication you could give to me that causes me heartburn. I don't know if there's anything you can do about it before you go.
Hello.
Hello.
You really can't hear
All
him.
right.
It's the
Hello?
medications. Yes.
Okay.
Hello.
Yes. I heard you talk about the medications. Which medication in particular are you talking about? Please, could you go over that again for me, Mr. Stephen?
There's one of these medications you gave to me for my knee pain, and anytime I take the medication, it causes me heartburn. Yes. Hello.
Okay. That should be the diclofenac, which is yes, I can hear you, Mr. Stephen. That should be one of the that should be diclofenac that we had added to help relieve your pain. But what we'll do is we'll change the medications for you. Taking that sometimes could bring about heartburn or stomach ulcers. So we will try as much to change that for you.
All right. Thank you
Is that
very
okay,
much.
Mr. Stephen?
Thank you so much.
You're welcome. We'll always be here
nice.
for you. If you have any questions or concerns, please always do. You can do well to reach us. I will drop my number with the nurses so you could reach us at any time. Thank you.
Patient still
All right, that's
wants
reassuring.
to, or
Thank you very
patient
much,
still
doctor.
complains. So you give the form for the complaint.
Mar, I didn't hear you.
Yes, I said patient in
Okay.
this scenario would still be complaining against you.
Yes.
So you have to give the form to the patient at the end. Okay, started the timer and here is your question. Right, so if you have read and understood, considering its surgical pathology station, kindly tell me what is the pathogenesis of the condition that you expect to happen?
I think this patient have there is.
What does the symptoms tell you?
It may be the symptoms of aortic dissection.
How? Can you explain? We'll do it together because it's shortness of breath, it's dyspnea on exertion, and it's generalized anasarca. What is anasarca? And then
Anasarca
yes,
means there is fluid all over the body.
All right, good. What is
Accumulation of fluid all over.
echocardiography showing?
It's showing that's mitral regurgitation, grade 3/4.
Yes. How this classification works? What is grade 3/4? How would you classify it?
Mitral regurgitation, ma'am.
Yes, please. The grading I'm asking you. Which grading system is this? NYHA?
I don't have idea, ma'am, about this.
All right. What is rheumatoid arthritis or rheumatic heart disease?
Rheumatic heart disease, ma'am.
Can you tell me what might be the organism involved in this condition?
It is due to
That's okay. Anyone else want to help? Dr. Ilmo,
Yes.
help the
Yes,
girl.
I'm asking.
Streptococcus viridis, Staph aureus, enterococci.
And can
Then
anyone tell me the pathophysiology? Can anyone help Dr. Ilmo tell the pathophysiology of rheumatic heart disease?
Okay, sorry. Can I say?
Can you
Okay.
answer, please?
Yes. Okay, go on.
Who is helping Dr. Ilmo? Anyone?
Okay,
so
so
many gentlemen.
streptococcus.
Yes.
So for rheumatoid arthritis, rheumatic heart disease, it is
Yes.
post or sequelae of infection with the streptococcal pharyngitis.
Okay.
It releases antibody. The body responds to this infection by produce antigen against these antibody. And this antibody, it's similar or close to the cardiac valve protein. So they destroy the valve and lead it to mitral regurgitation.
If you look at the valve, what would be the gross findings that you'll look or you'll find?
If you look at cross finding, either we saw vegetation due to complication of the infective endocarditis or calcification fibrosis.
Can you help me and classify it in acute and chronic like this and tell me? In acute phase, what would you see and what would be the
acute? Yeah, in acute phase, we can see the vegetation of the infective endocarditis, but it didn't affect the function of the heart. But in the later on, it is caused due to injury of endocarditis, injury of the valve, so will lead to fibrosis, the deposition of the inflammatory cell, fibrosis, calcification, and fusing of the of the cusp will lead to the fish mouth.
Okay. Can you please help us and tell us the criteria through which we can classify the condition?
The criteria for what?
Classification of rheumatic heart disease. Can it be classified according to any criteria? What is the name of criteria that we use?
I forget this one. Yeah.
Okay. Can you tell the criteria which we use for rheumatic fever then?
For rheumatic fever?
Yes, now Dr. Moon is trying to tell you.
Is it Duke's criteria, ma'am?
Jones.
Jones criteria.
Duke's is got. Okay, can you tell me what is echocardiography showing? What would you see? Can you tell us? If you do 2D echo, what will it show?
It will show the valvular regurgitations and the leaflet. Was the leaflet prolapse or coagulation failure thickening, annular dilatation, then caudal elongation or rupture? Is there any increased echogenicity of the apparatus, pericardial effusion, and ventricular dilatation and any kind of dysfunction?
All right. What should be the management of this condition?
In that case, we will give the patient IV antibiotics, depending on culture and sensitivity.
Okay.
For 6 weeks.
Yes. As long as you're waiting for the results of your culture, what would you do meanwhile? What happens if a vegetation dislodges, and what can happen with the vegetation if it dislodges from the valve? What can it do?
It can do thromboembolism.
All right, good. So how would you manage that condition? because it's a risk factor, right? So what
Yes.
measures would you do to manage that?
In case of thromboembolism, we prescribe the patient heparin, low molecular
Okay.
weight heparin,
Anticoagulants, all right.
or any kind of anticoagulants.
Yes.
Or if the patient
If you need to
can-
operate on the patient urgently, which anticoagulant would you give and how would you reverse that, or how would you manage that, or how would you tackle the situation? Ultimately, because you said it's mitral regurgitation, you would have to,
so we will go for the, if the patient doesn't respond to medical treatment, we go for the valve replacement
yes,
or
valve
heart
yes,
heart
prosthetic,
transplantation.
yes, okay.
Yes.
So if you're doing the valves, you're into like replacing the valve, and you're going to have prosthetic valve, and patient is already on anticoagulants, what would you do?
I will, if the patient is taking oral anticoagulant, I will stop, like warfarin, we will stop 5 days before the surgery, and
Okay.
we will start the IV heparin
Okay.
and IV heparin. And after the completion of the surgery, before stopping the IV heparin, we will do the INR. And when it is in optimum level, then we will again start the back this old regimen like warfarin or again.
INR is used for the monitoring of which anticoagulant?
It's for warfarin.
Yes. So if when you are giving IV heparin, which test would you do, or what would you monitor?
PT test, ma'am.
Anything else? This heparin acts on which
APTT.
no, which clotting factors? It acts on which clotting factors? Oh,
Vitamin K dependent.
which ones are those? Yes. Which ones are those?
Yes, 2, 7, 9, 10.
Are you sure? Okay. Started the timer, and here is your question. Right, so if you have read and understood, considering it history-taking station, kindly begin.
Hi, I'm Dr. Dafur, one of the surgical doctor looking after you. Could you confirm your name and date of birth, please?
Age.
Age.
I am Meena, and I'm 19 years old.
Good.
Nice to meet you. How can I help you today?
Good.
Doctor, I'm feeling so much pain. I cannot tolerate.
I'm sorry to hear. Yeah. I'm sorry to hear that. Can you tell me more about it?
Yeah, the pain is all over my tummy, and it's not feeling me well. I cannot eat properly. What I've eaten, I just gave out through vomiting, and otherwise I'm feeling so weak. Can you help me?
Yes, I will here to help you. I'm sorry to hear that. Can you ask you more detail about your pain? Where
Yes.
it's the start?
It starts around my umbilicus, and later on it becomes all over.
All of
Abdomen.
abdomen, yeah.
Yes.
Okay. For how long that?
It's just for the last 24 hours.
Okay. And could you describe how is it? The nature, it's colicky, dull, or sharp pain, or
Yeah, it's something like colic. It just come and go, but it's so sharp that I can't tolerate.
it is fixed or it's progressive, the same, or it's progressive during the day?
It's progressive. It's not stopping.
What do you think you do to relieve this pain?
Yes, doctor. What did you say?
Anything make this pain more aggressive, aggravate this pain or more?
No, doctor. I didn't feel anything happens with me like
anything,
that.
yeah, anything you will do to decrease this pain?
I took some medications like paracetamol, but it didn't go. It comes back.
Yeah. How it's bad and affect your life?
Good.
Do you mean how bad it is?
Yes. Firstly, how severe of it? It's really from the 0 to the 10.
Okay, so what is 0 and what is 10?
0 is no pain, 10 it's maximal pain, yeah.
Okay.
Severe pain.
It's 7 by 10, doctor.
So you are in pain now.
Yes, doctor, I'm in pain.
Do you want
can
to
hear
prescribe some medication to relieve that pain, or you okay?
I'm still okay to talk with you, but later on
Okay.
I want some good medication.
How it affect your life?
I cannot eat anything. I cannot sleep
Okay,
for the whole
I
night.
I imagine how it's bad to feel the pain. Okay, you said you throw up. It does associated with the blood.
No, doctor, it's not with the blood. There is no blood.
Do you feel the acid in the back of your throat, of your mouth?
No, doctor, I didn't see anything like that.
Do you have any change in the bowel habits?
Yeah, I already told you that I have loose motions.
It is with the blood or without?
It's without blood, and it's
painful or painless?
It's painless.
Okay. Do you have any fever?
No, doctor, I don't have any fever.
Have you any lethargy?
Yeah, I'm a bit lethargic and weak.
Any decrease in the body weight?
No, doctor, I am healthy.
Yeah. Do you have any same attack before?
No, doctor, I didn't like this pain before.
Any bloating?
No, doctor, I didn't
any
have
shortness of breath?
No, my breath is normal.
Okay. Have you had any past medical illness?
Doctor, I have asthma, like, but it's childhood asthma.
Yeah. So have you had any surgery before?
No, doctor, I don't went for any surgery.
Do you take any medication?
No, doctor, I didn't take any medication. But
do you take any
sometimes
drugs?
I took inhaler for my asthma like problem, but it's in winter.
So it is not routinely taking the inhaler every day?
No, doctor, it's just in winter.
Okay. Any allergy for drug or medication? Sorry, to medication?
No, I'm not allergic to anything. I'm completely fine.
Okay.
Can you present your case now?
It's 19 years old, previously well. She presented with the abdominal pain, dull, firstly pre-umbilical, and then generalized abdominal pain, no radiation. Severe, it's progressive, associated with the nausea, vomiting, and the change in the bowel habit become diarrhea. She's not take any medication apart from sometime inhaler for, because she had background for asthma.
So what are your differential diagnoses?
It's either appendicitis, or
Okay.
can I put gastroenteritis?
Yes.
And then can put cholecystitis, but from that, and then yes.
All right. How do you plan to confirm your diagnosis?
I went to complete our history and examination.
Yes.
And I also we will send her for blood test,
Yes.
which include full blood count, liver
Yes.
function test, biochemical test, liver function test, renal function test, coagulation, and also we send her for a stool for occulted blood and microbiology and culture sensitivity. Also, we send abdominal X-ray and
Yes.
ultrasound. And
Yes.
also in the biochemical, we liver function test, bilirubin direct or indirect. And also, if I think
What
it's mesenteric or
management or treatment can you suggest for her?
so, I suggest the medical treatment. Firstly, because nothing by mouth, analgesia, IV fluid, antibiotic.
Yes.
Yeah.
And if your medical or conservative management fails, then what can you
It's
suggest?
not. So according to the case, I suggest surgery for her.
What was the last word? We'll discuss with MDP, considering the report. Okay,
Yeah.
good. Right, so who wants to give feedback? It was quite better from last time, but what are the things that you have forgotten?
Yes, I
One-
didn't go. Yeah.
You didn't get to
You
complete
forgot
the
to take
history.
my personal history.
Yes.
Personal history.
Yes, and
I think it's because of me.
Social
I
history.
took it.
no, that's all right. And ice, you forgot to discuss.
Yeah, I
And
put it in front of you, but the time it is not important. Yeah.
Yes.
We need
yes,
to.
Yes. But then when I was asking you, then you could have mentioned it, but you even forgot that.
Yeah.
Yeah. And then one important thing, whenever there is abdominal pain, so you always do the, what exactly you do?
Scoring. Scoring.
Scoring, he
You
did.
forgot to do the scoring.
One type of examination.
But he didn't
Direct-
mention the 0, 10, what is 0 and what is 10.
Yeah, but then when you asked him, he did tell you.
Yes, yes,
but-
I did it. Yes.
Yes.
Otherwise,
So,
he did it nicely, very well. He is very
Yes.
fluent and very
sounded
representative.
professional, but then that's
Yes,
not
ma'am.
why we come here. We come here to improve. So okay,
Yeah.
he came to know the things that he missed, and then the things that he took more time, and last time he covered that this time. But then yeah, travel history he forgot, social history, and the I told you. What else? Something which is important whenever there is abdominal pain, patient with abdominal pain, there is an important test that you, even if you forget, you should mention it to consider it being done. DRE, direct
Yes, ma'am.
rectal examination. So
Okay, yes, it is
mentioning that was also important.
No, yes, because because I'm confused because I need to put the diagnosis.
Yes.
She didn't help me to give me a direction to go to the appendicitis or
Okay.
cholecystitis or inflammatory bowel
Dr.
diarrhea.
Duffer, since
So,
it's a female
yeah.
patient, You told
Yeah.
me three possible conditions, and I accepted them. Since it's a patient, female patient, and she's young, and it says that she is not sexually active, so pelvic or otherwise pregnancy is out of the list, right? But since it's a female, what other conditions can be associated or can be there?
Inflammatory bowel disease,
Yes, all right.
endometriosis, ovarian cyst,
Yes,
ovarian torsion, yeah, salpingitis.
and you did ask her if it's associated with the mens, but she said no. But what does she know? Maybe she has painful mens.
Yeah.
So, or there's a 2 weeks before the pain. What does it call? I am saying it, but I want you to tell me.
I know the name, but I forget it now.
Yes,
It's
but then you
2
can
weeks
write.
before, yeah.
Yes, so you can make a list of all the possible conditions that can be there, and then quickly mention them 1, 2, 3, 4 at least.
Yeah.
So you are interrupted by the examiner with the next question. Thanks.
Yeah.
Yes. Where is your station? Right, so if you have read and understood, kindly tell me what is the structure that you're looking at?
And this
Yes.
and its surrounding structure.
Yes, what is this structure that you're looking at?
This is the stomach.
Yes, can you name the parts of the stomach? What is 6, please?
The stomach has
Can you identify the
6 is the fundus.
Okay.
Fundus
What-
of the stomach.
Yes, what is 2?
2 is 2.
It's here with my
Where
arrow.
is 2, ma'am?
Yes, my arrow is
Okay,
pointing
body of the stomach.
stomach. What is this attached
Body
to
of the stomach.
What is this attached to the body?
This is the greater omentum.
All right. What is this? 18?
18 is pylorus.
19, please.
Pyloric canal.
23.
Duodenum. First part of duodenum.
All right. Can you please tell me the blood supply of the stomach?
Stomach is mainly supplied by the branches of the celiac trunk. That is by the left and right gastric artery,
Yes.
right and left gastroepiploic,
Yes.
and the short gastric artery.
All right. What about the venous drainage of the stomach?
Venous drainage is also same, but
Yes.
it is the right and left gastric drains into portal vein. The left gastroepiploic and short gastric drains into splenic vein, and the right gastroepiploic drains into the supramesenteric vein.
All right. Can you please identify the next structure? What kind of image is this that you're looking at?
It is the barium solo.
All right. What diagram A, B, and C shows you? A, B, and C. Can you identify 7?
Is the 7 is hyoid bone.
What is 6?
6 is the cervical vertebra.
3.
3 is the upper part of esophagus, proximal esophagus.
What is this 1? 1, please.
Uh,
Yes, here in picture B.
is
What is
esophageal
2?
constriction.
What is 2? This indentation is because of which organ?
Arch of aorta.
What is 3, please?
3 is the distal. I think this is middle part of esophagus.
What is
Thoracic.
8, please, in picture C?
8 is the abdominal part of esophagus.
What is 5, please? Quickly, we have to identify all the structures.
5 is distal esophagus.
Okay, and this 4 is showing you something. Can you
It's
please
the
identify?
cardioesophageal junction.
Okay, this constriction. Okay, what is 9, please?
9 is the cardiac end of the stomach.
Okay, can you please identify the next diagram as well? What is this 1? Please.
1 is the body of the stomach.
2,
2 is the greater curvature.
3,
Is the lesser curvature.
4,
4 is the pyloric antrum.
5, and 6, please.
6 is the first part of duodenum, and 5 is the pyloric canal.
Okay, can you please tell me what is the lining of the esophagus from top to bottom?
Esophagus is lined by non-keratinized stratified squamous epithelium.
Top to bottom? Is it the same lining all through the esophagus? What kind of carcinoma is common in esophagus?
Esophagus adenocarcinoma.
All throughout?
Sorry, squamous cell carcinoma in the proximal part and adenocarcinoma in the distal part.
Yes, good. Okay. What should be the management for each kind of carcinoma in esophagus?
Depends on the site of the
Carcinoma, yes.
carcinoma. In the proximal part, usually we can try radio and chemo. In the
Yes.
distal part, it is usually surgical.
Yes. What should be the management
We
in
do-
that condition?
We do the Ivor-Lewis operation in the
This
distal
we
part.
have to, yes, revise. Okay, can you, I think there is one more. No, that was it. Okay, can you tell me what is the lining epithelium of stomach? Come back to stomach.
It is lined by simple columnar epithelium.
What is the most common type of carcinoma in stomach?
Adenocarcinoma.
Okay. What should be the management? How would you classify the carcinoma of the stomach, and how would you manage it?
It depends on the stage. Again,
Yes,
stage 1, 2, 3, and 4.
according to
In
which
the earlier
classification
stage,
are
we
you telling
can
me? Is it TNM or anything else? Any other classification you can recall?
1, 2, 3, thing
Is a
TNM
special
classification.
name? Okay. Tell me. Can you describe?
There are other
Yes, please.
classifications also,
Yes,
like
please.
WHO classification.
Yes, please.
Adenocarcinoma, small cell, and undifferentiated carcinoma.
Okay.
According to Lauren classification,
Yes.
we can classify as intestinal type,
Yes.
diffuse, and unclassified.
Yes.
And other one is the expanding type and the infiltrative.
Right. Can you tell me the blood supply of the esophagus?
Esophagus, cervical part is supplied by inferior thyroid artery, thoracic part from the esophageal branches of thoracic aorta, and abdominal part from the esophageal branches of left artery.
All right. What about the lymphatic drainage of the esophagus? That was the last question.
Mediastinal lymph nodes and the abdominal part into the left gastric lymph nodes.
Good. Thank you.